Here we're going to show a technique to help relieve tension from the shoulder blade on the ribs. So what tends to happen with our clients is they tend to get stuck in protraction with the shoulder blade. Protraction and upward rotation actually. So Kika's going to rest her arm on the table like so, and we're going to try and peel back the shoulder blade and release these lateral muscles here. So we've got the teres, maybe some subscap, some serratus, some lats. So I'm going to take a seat. My hip is in contact with our lower back, and I'm going to pull the tissue this way. So my job is to pull her arm backwards. She's just relaxing, and I'm pulling here. So I'm just trying to open up this lateral line. Okay? No pitching in the shoulder. If I want to apply a deeper pressure, a more specific pressure, I'll bend my elbow. I'm still in front of her shoulder blade. I'm just going to trace around this way. So I'm trying to rotate her out of her pattern, the gravitational pattern of internal rotation. Move slow, and just follow the line of the shoulder blade, the scapula. We talk a lot about this in our seminars. There's many planes of movement the shoulder blade can move through, but we tend to get stuck in protraction and upward rotation. Yeah. So I'm leaning in, and I'm pushing this way. I'll just play with the arm. As we do this, we can ask the client for motion. So Kika's going to put her hand on her hip and open up like so. So I apply pressure first, just one moment, and start opening up slowly. And we just facilitate this opening here. Nice. And relax the arm where it is. This is the great technique for those clients who are having sort of shoulder impingement, lack of flexion, overhead flexion and internal rotation. This will really help free up those planes of movement. Commonly what we see with clients who have limited abduction, most of that initial movement should come from movement of the shoulder blade. If that doesn't, our clients tend to move like this. They do this type of action. So we want to free up the ability for the shoulder blade to move out of protraction. Sorry. Kiki says my massage is too light. And I can just as easily, by the way, face downstream as well. So I'm on the shoulder blade here, I just lean in this way. So really take your time with this stuff. But don't neglect this little pocket of tissue here, because you're getting a lot of stuff. Like I said, you're getting the lats, the teres, some infraspinatus, possibly some serratus. Those muscles get very congested. Then I'll take a nice contact my hip against Kiki's mid back, lower back. She's grabbing the table, if possible. If she can't, she can reach across the ear and the eye like so. If she can open up this way, even better. So I'm gonna find the lateral border of the shoulder blade, and that's the tissue I wanna move upwards and away. So my job here is to introduce shoulder rotation this way, just gentle traction rotation, and scapular retraction here. So I'm working on shoulder, Here I'm working on shoulder blade, scapula. We can have Kiki do active range of motion. So she can do like a shoulder clock and start opening up slowly. So nice and slow. She really opens up. You can help. Good. We can bring into this type of angle. Now, apply pressure here, left hand, and open up this way. Or, even better, have them do the motions. So you teach them this movement. It's like a pin and stretch. Sometimes when you get into this position, they may complain of shoulder discomfort here. Could be an AC joint, could be many things, but it's shoulder pain here. So what we may need to do is change our angle of pressure and sit this way. So we can still release the shoulder girdle, but minimizing the shoulder compression this way. So two great ways of really working the lateral border of the shoulder blade. Here now we're really slacking, we're really shortening the muscles. So her arm's just rested on my shoulder, I hold, I just come across this way. Then we can start opening up. But these tissues around the posterior shoulder blade tend to get very compressed, very congested, and laden with trigger points just because of the gravitational stresses we're all under. So don't neglect this little pocket of infraspinatus, teres, lat, serratus, and then probably in subscap. We're getting all that tissue. We're getting all this tissue in this technique. But the key thing is, well, we're moving the structure, we're moving ribs, we're moving the shoulder blade, and we are moving the glenohumeral joint too. Great little technique.